Hello, my name is Angela Yost, and this is my head-to-toe assessment for Maryville University. This is my volunteer AY. He is a 40-year-old male that has volunteered to be my patient for this video. Prior to the video or to the exam, we did a full set of vitals, height and weight. We checked his distance vision with the Snellen chart, and we checked his near vision with the Rosenbaum chart. He emptied his bladder, he applied the shorts and the shirt, and I washed my hands. And now we'll begin with the assessment. Now, first, general inspection. I'm looking at the head, I'm looking at the skin, I'm looking at respirations, which are even and unlabored. No nasal flaring noted. The patient is alert. The head is not tilted. There's no tremor noted to the head. When I want to look around and I don't see any abnormalities, first thing I'll have you do is go ahead and give me a nice good smile, and then stick your tongue out and move it side to side. Alright. And then I'll have you squeeze your eyes shut nice and tight, and then open them, and then raise your eyebrows up. Alright. And everything looked good there and symmetrical. And then I'll go in and I'm going to palpate the skull, and I'm feeling for any indentations, any masses. I'm feeling the scalp, the movement of the scalp. I'm feeling for any lesions, any scaliness, dryness to the scalp. I'm feeling the distribution or the texture of the hair, looking at the distribution of the hair, which is nice and soft. And then coming down, I will feel the facial bones for any abnormalities, any masses, and I don't feel any. Then I'll go ahead and palpate the maxillary sinus, and then the frontal sinuses for any swelling, tenderness, any pain with that.
No.
Then I'll check the temporomandibular joint. I'll have you open your mouth and then close it. Any pain with that? Just checking for any clicking or popping feeling with that. The next thing I'll do is looking at the eyes. I am looking at the symmetry of the eyes. I'm looking at the eyebrow, the hair distribution. I'm looking at the eyelashes, how they come outward. I'm looking at the sclera of the eye, which is nice and white. I'm looking at the conjunctiva, which is pink and moist. I noticed no redness or drainage around the eye. I will palpate the lacrimal apparatus around the eye, and then feel the eyelids. I note no ptosis with the eyelids. They are closing, and I don't note any orbital, periorbital edema around the eyes. Next, what I'll do is I'm going to check your extraocular movement. So I'm going to have you follow my pen with just your eyes. And here, I'm looking for any nystagmus or any abnormalities with the eye movement, which those are intact. The next thing I'll do is I'll go ahead and check pupillary response. So I'll have you look right at my nose, and then I'm going to do a direct light, and then consensual, and then direct light, and then consensual, which that is intact. The next thing we'll do is we'll do the cover and uncover. So I'll have you cover your right eye and have you look straight ahead for me. And then go ahead and uncover. Okay, and then we'll cover the other side and look straight ahead, and then uncover. And what I'm looking for is any misalignment of the eye with that. The next thing we'll do is I'm going to check your peripheral vision, and we'll do the confrontation test. So I'm going to have you go ahead and cover your right eye. I'm going to cover my left eye, and I'll have you look right at me, and you tell me when you can see my fingers come into your peripheral.
No.
Alright, and then we'll do the other side.
No. No. No.
Alright, so peripheral vision is intact. The next thing I'll do is we'll take a look at the ears. The ears are nice and symmetrical. I'll fill the auricle of the ear, which is nice and warm and pink. No discoloration is noted, no masses, no lesions. The auricle is firm and mobile. I feel no masses or lesions behind the ear. And now we'll take a look at the inner ear. I'm going to pull up and back and into the ear canal, which I detect no redness. Hair distribution is good, minimal cerumen, and the tympanic membrane is translucent and pearly gray. We'll go to the other side, which I'll pull up and back, place the otoscope in, and I can look in, and I'm looking at the hair distribution, I'm looking at the canal. I detect no redness, no drainage, and the tympanic membrane is translucent and pearly gray. The next thing we'll do is we'll go ahead and check your hearing. So I'm going to stand behind you, and I'm going to have you go ahead and cover your ear. So I'll have you cover your left ear, and then you tell me the word that I whisper.
Orange.
And now have you cover the other side, and then tell me what you hear.
Apple.
Okay. So that's intact. The next we'll do is the Weber and Wren test. So the Weber test is, I'll take the tuning fork and I'm going to place it to the top of your head. And at that point in time, I want you to tell me if you can hear it in both ears or if you hear it more on one side compared to the other. Okay?
Okay. Both sides.
Both sides? Okay. And next we're going to do the Renee test. And I'm going to take the tuning fork and I'm going to place it to behind the ear in the mastoid. And you tell me when you don't hear it anymore. Oops. So air conduction should be twice as long as bone conduction. The next thing I'll do is I'm going to look at the nose, and I'm looking at the alignment of the nose, which is nice and midline. I'm looking at the nasal, there's no nasal flaring. I'm looking at the nostrils and those look fine. I'm going to look up inside of the nose, and I'm looking at the nasal mucosa, which is nice and pink. The nasal turbinates are nice and pink. I'm looking at the nasal septum, and it is midline with no cracking, no perforations, and no bleeding noted. And we'll check nasal patency, so I'll have you cover one nostril and breathe out, and then I'll have you do the other side. The next piece, what we'll do is I'm going to take a look at the mouth, and I'm looking at the lips. Those are nice and symmetrical. They're pink, supple. I notice no cracking, no bleeding, no irritation around the mouth. I'll have you go ahead and open your mouth for me. And I'm going to look at the buccal mucosa, which is nice and pink and moist. I'm looking at the teeth. I'm looking at the distribution of the teeth, the quantity of the teeth. I notice no cracking teeth. I notice no missing teeth at all. I'm going to have you go ahead and stick your tongue out for me. And I'm looking at the tongue. I'm going to have you go ahead and lift it up and move it over to this side. There you go. And I notice no lesions or opened areas. And I'll have you go ahead and lift it up, touch the top of your mouth. And no lesions under the tongue. And I'm looking at the floor of the mouth, and it looks good too. So the next thing I'll do is I'll have you go ahead and open your mouth again, and I'm looking at the uvula, the posterior pharynx, the anterior and posterior pillars, the tonsils. I'm looking at the soft palate, the hard palate, and everything looks good. And so the next thing we'll do is I'm going to have you say "ah." Go ahead and do it again for me. And the uvula rises up, and it is midline. And then we're going to check your gag reflex. And it's there and intact. So the next thing we'll do is I'm gonna go ahead and check sensation, okay? So I'm gonna have you close your eyes and just tell me when you can feel me touching you.
Yes. 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 Yes.
So sensation on the face is intact. We'll go ahead and check sensation everywhere else. Can you feel that?
Yes. 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 Yes.
Does it feel even?
Yes.
Okay. You feel?
Yes. 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 Yes.
And does that feel even?
Yes.
Alright. So the next thing I'll do is I'm gonna take a look at the neck, looking at the trachea, which is midline. I'm looking for any masses, any abnormalities, any lesions, which I do not see, any discoloration to the skin, which I do not see. This time we'll go ahead and check range of motion of the neck, and I'll have you look up towards the ceiling, and then I'll have you look down. I'll have you turn, and then I'll have you turn the other way. And then I'll have you go ahead and take your ear to your left shoulder, and then your ear to your right shoulder. Any pain with that?
No.
No? Okay. So then we're gonna go ahead and do that with some resistance. Oh, let's have you shrug your shoulders for me too. That's good. And then we'll check with resistance, so I'll have you come towards me, and then bring your head back, and then go ahead and bring it in, and onto my hand again. Alright, and then I'll go ahead and bring your shoulders up, and don't let me push them down. Good job. So then I'm gonna go ahead and palpate the neck, and I'm feeling for any kind of masses or anything that's any abnormalities. I'm feeling the trachea, which is midline, and I'm gonna feel for the thyroid. Then I'll have you take a nice deep, go ahead and swallow for me. And that's good there. The next thing, I'll go ahead and palpate the carotid artery. And I'm feeling for intensity and amplitude. And I'll do the other side. Feeling again for the intensity and amplitude of it. And then I will also take the neck. With the bell of my stethoscope, I'm going to have you go ahead and hold your breath while I listen. And again, I'm listening for any bruise. And then go ahead and breathe. And then we'll do the other side and hold your breath. And then we're going to breathe. And then I'm also going to listen over the thyroid for any bruise, which I do not hear. So the next thing I'll do is I'll go ahead and I'm going to look at the arms and feeling the muscle tone of the arms, feeling the temperature of the arms, looking at this color of the arms, looking at the distribution of the hair. I'm going to look at the hands and the color of the hands, the fingers, the palms of the hands, looking for any kind of edema, any abnormalities. Any cyanosis to the nail beds, which those are nice and pink and intact, and capillary refill is brisk and less than 3 seconds. While I'm here, we'll go ahead and check the brachial pulses, and then the radial pulses. And then I'm going to go ahead and palpate for you the lymph nodes. So I'm going to start at the occipital lymph nodes, and then the post-auricular lymph nodes, pre-auricular, tonsillar, the submandibular, submental, and then the superficial cervical, posterior cervical, the deep cervical, and then I'm also going to feel the supraclavicular lymph nodes and the infraclavicular lymph nodes, which I don't feel any, and that's good there. The next thing I'll do is I'll go ahead and feel your axillary, so I'm gonna have you relax your arm. I'm gonna bring it up and I'm gonna feel your axillary lymph nodes. And then we'll do the other side. I'll have you relax your arm for me. And we'll feel for. And that's good there. So the next thing I'll do is I'll go ahead and move to the back. I'm gonna have you go ahead and remove your shirt for me. And then we'll turn you just a little bit. As you can see. There you go. I'm actually gonna have to turn you a little bit more. There we go. So looking at the posterior back, I'm looking for any color discoloration. I'm looking for any obvious masses, any lesions, any abnormalities. I'm also looking at the respiration at this point in time to make sure that it is symmetrical with each breath that he's taking. I'm also looking that he does have some scattered freckles on his back, but no obvious abnormalities. Excuse me. I'm going to go ahead and check for thoracic expansion. So I'm going to have my hands right here, and I'm going to have you take a nice deep breath. And again. And there I'm looking for my thumbs to come apart and the symmetrical of when he takes his respirations, which it was nice and symmetrical. The next thing I'll do is I'm going to go ahead and palpate the back, feel along to see if there was any abnormalities, if there was any areas that might cause me some concern. I'm going to check the costovertebral angle for any tenderness. Any tenderness there?
No.
No. The next thing I'll do is I'll go ahead and I'm going to percuss down the back, which I should hear resonance. And then we'll do the other side. Alright, and then we'll go ahead and do the side. Alright, so the next thing I want to do is I'm going to go ahead and do diaphragmatic excursion. So I'm going to start at the top here. I'm going to have you lean forward just a little bit and cross your arms. And then I'm going to have you take a nice deep breath and hold it. And then where it goes to dull, I'm going to mark it. And then I'm going to have you go ahead and blow out and hold it. And that should be about 3 to 5 centimeters, and that is within the parameters for where the diaphragm is. The next thing I'll do is I'll go ahead and auscultate the lung from the back. With the diaphragm on my stethoscope, I'm going to have you go ahead and take a nice deep breath. And here I'm listening for any wheezing, bronchi, crackles, and then I'm going to go ahead and have you bring your arms up, and I'm going to listen to the sides. So then I'm going to go ahead and check for tactile fremitus. So what I'm going to have you do is say 99 for me as I feel your back.
99, 99, 99, 99.
Okay, so that was good there. So then I'm going to go ahead and move around to the front. I'll have you turn back around for me. Again, I'm going to look at the chest wall. I'm gonna look for any abnormalities. I'm looking at his respirations, that they're even and unlabored. There's no accessory muscles being used. I'm gonna go ahead and palpate the chest wall for any abnormalities at all, which I don't feel any at all. And then I'll go ahead and percuss the front. I'll start here. Alright, and then we'll go ahead and do tactile firmness. So say 99.
99, 99, 99.
Okay, and that was good there. The next thing I'll do is I'm going to go ahead and listen to your lung fields. And again, I was listening for any wheezing, bronchi, or crackles, which I did not hear any. Now I'm going to go ahead and listen to your heart sounds. And with the diaphragm, I'm going to listen to the aortic. And again, I'm listening for any murmurs, anything that's abnormal. And then the pulmonic. Herb's point. The tricuspid. And then the mitral. Then I'll have you come forward for me just a little bit. And everything sounds good, no heart murmur. And then I'm going to go ahead and feel the precordium. And again, I'm feeling for any lifts, heaves, which I do not feel. I'll feel for the apical pulse. And again, I'm also feeling for any pulsations, any lifts or heaves, which I do not feel. The next thing I'll do is, since we have you sitting up, I'm going to go ahead and look at the legs. And I'm going to feel for the muscle tone of the legs. I'm looking at the color of the legs, any abnormalities of the legs, any lesions, any opened areas to the legs. I'm looking for any edema, which I do not see. I'm going to go ahead and check your pedal pulse, or actually I'll do the popliteal pulse. And I'm feeling for intensity and amplitude. And then the posterior tibial. And then the dorsalis pedis. That's good. And overall, we're going to go ahead and check strength. So I'm going to have you bring your arms up for me. And don't let me push them down. And then don't let me push them up. Alright. And then I'm going to have you squeeze my fingers for me, hard as you can. Okay. Hold your fingers out, straight out like that. Don't let me push them in. Alright, good job. So then on the legs, what I'm going to have you do is push out on my hands, pull back, and then hold your toes straight up. Don't let me push them down. And then go ahead and push down. Alright, strength is good and nice and equal. We'll go ahead and check reflexes. So I'm going to check the brachial reflex. And then I'll go ahead and check the patellar. You have to bring your legs. Okay. And then we'll check this side. Okay. And then I'm going to check the Achilles. Okay. So we check the reflexes there. Alright. So the next piece, what we'll do is we'll go ahead and we will take a look at the abdomen.